Hello, everyone. Welcome. We will get started in just a moment here. Give us a second to get set up, but really glad that y'all are here for our June Community Engagement and Communications Committee.
I am all set.
Great. Thanks, Isabel. Do we have a quorum?
Yes.
Perfect. Well, welcome again, everyone, to the June meeting of the Community Engagement and Communications Committee of the Universal Health Plan Governance Board. I am Michelle Glass. I'm one of your co-chairs, along with Amy Fellows, who I don't believe will be able to join us this evening. But we are going to get started with a quick tech check. We'll do a formal roll call of committee members, and then we'll review our agenda before we jump into it.
Yes. So tech check today. You should all have a menu bar. For most of you, it'll probably be at the bottom of your Zoom screen with the for committee members, ability to turn on and off your video and microphone. And we also have Spanish interpretation available today. If you click the sort of globe-shaped icon in that menu bar, you can select either English or Spanish, whichever language you would like to listen in today. And with that, I think we can go into roll call. So Michelle Glass.
Present.
Amy Fellows, I know, is unavailable tonight. Grace Hockhog, I don't see Grace yet. Mickey Derting, I know, is going to be a little bit late tonight, but she is planning on joining as soon as she can. Colin Stackhouse.
Present.
Thank you. Max Brown.
Here.
John Buzzard.
Here.
Juana Yesenia Hernandez Solis.
Here.
Jocelyn Ogden.
Here.
Juan Pablo Villalobos Garcia.
Present.
Jensina Hawkins.
Present.
Jay Brown. Don't see Jay. And Craig Newton.
Here.
Thank you, everybody.
Thanks, Isabel. And I also want to just say a warm welcome back to Juan Pablo. Thank you so much for your continued commitment to serving on our committee. We're thrilled to have you back with us. So thank you. All right, so a quick agenda check. Oh, did you want to say anything, Juan Pablo? Sorry.
Yes, and to say thank you. Thank you one more time for staying here and for providing my experience. So thank you guys. Thank you for this excellent job and this excellent space for promote more opinions, comments. So thank you.
We're thrilled to have you back. So on our agenda this evening, we're going to have some updates from our fabulous board executive director, Dr. Miriam McDonald. Thank you, Mimi. We are going to have the presentation that you all requested and have been looking forward to on the Elway poll by Warren George. So thank you so much, Warren, for your time this evening and sharing this great public polling on universal health care in Oregon. We're, of course, going to have our protected time for public comment. And then we'll have kind of our normal standing agenda items as well. So any updated thoughts or recommendations from committee members on future engagement planning, especially things that could potentially be included in the report to the legislature in the section on community engagement. Committee member updates, And then we'll end with meeting reflections and future topics. Does anyone have any questions about the agenda? All right, hearing none, I will pass it to you, Mimi.
Thank you so much. All right. Good afternoon, everyone. Thank you so much for joining us here today. I'm Mimi McDonald, Executive Director of the Universal Health Plan Governance Board. So I'd like to provide you all with some updates about what the Transition Committee has been up to and also what's been happening at the board. So Transition Committee at our last meeting had a lot of discussion around information technology strategies, kind of at a higher level of what really might be needed for an IT strategy for a universal health plan. There'll be continued discussion around that. Senior Policy Advisor Lee Hastings gave an excellent presentation about the potential under a universal health plan for prescription drug savings, which was great. We also discussed a lot, very many thanks to Mickey Dirting, about transition readiness and how even to evaluate whether or not there is transition readiness, which is great. At our next Transition Committee meeting, we will be diving back into some of that prescription drug savings. And then also I will be humbly presenting to the Transition Committee about the work of this committee, Communications and Engagement. Will be I'll be giving them actually a recap of what the Joint Task Force did, all the work that this committee has done, including all the work this committee has done about sort of future planning and future engagement activities, just to kind of get some discussion going with that transition group to see what they can bring, kind of what perspective they can bring to things that might be useful in the upcoming months and years for a universal health plan. So really looking forward to that. That's tomorrow, in case anyone wants to join us, 1 o'clock. Next, we had a great board meeting last week on Thursday. The board continued to revise their revenue plan. Another decision was made regarding there had been an element within the plan of the potential for a lodging tax. It would be a small increase in the lodging tax, but there was a great discussion about, well, who would actually be paying that tax, and back and forth. A lot of information was shared, and in the end, the board decided to keep that. It already had been in the revenue plan, and to keep that slight increase in a lodging tax within the revenue plan itself. We also had another great discussion about the analysis of the expenditures, and especially going into a little bit more about the specifics of the Milliman report that was generated, and layering on top of that, or almost subtracting from that actually, would be the potential savings from administrative efficiencies and other things that are inherent within a universal health plan, to come up with some revised numbers about what the board believes will actually be the true cost of a universal health plan. Our Echo Northwest consultants gave a great review on reserve funding. We did not get to governance and statutory gaps because there was a lot of discussion that had to keep happening. And after another presentation from Senior Policy Advisor Lee Hastings, kind of about the sequencing or the rollout of a universal health plan and what some options would be, whether it would be starting with everything all at once or being a more stepwise transition in terms of populations being rolled into the plan. And the board, excuse me, again, had a lot of discussion about that. Ended up with general consensus around having more of a I don't know if it's stepwise is the right approach, but recognizing that there is the potential that some populations will be starting with the universal health plan before other populations. So great meeting. And I believe that is all I have. I'll just see if there's anything else or board members wanted to add, or if there are any questions.
Nothing additional from me. Does anyone have any questions for Mimi?
Thank you.
Thanks so much, Mimi. All right, well, that brings us a little ahead of schedule, which is great, because I know you all will have lots of questions for Warren, who says he's up for it. So thank you, Warren. I will turn things over to you. And then again, I'll just give you a quick time check about halfway through our time, and then we do have a hard stop at 5 for public comment. But if there's a few things to finish up after that, we can come back to it after public comment. So take it away.
Okay. Thank you, Michelle. Let me just get things up on the screen here. That always takes just a moment.
And while you're doing that, Warren, maybe I'll just say for folks who don't know Warren, I know many of you are aware of Warren's long commitment to this effort, but this poll would not have happened without Warren. So we're really lucky to have him here sharing with us tonight because he knows everything about it. And he was involved in the task force that laid the groundwork for the work that the board is doing now. And he was also the vice chair of the board. So if you're wondering kind of how Warren is connected to this work, I wouldn't be here, and a lot of the current board members wouldn't have a board to sit on if it wasn't for the work that Warren and others did. So I just wanted to give that context and again, turn it over to you, Warren.
Thanks, Michelle. Thanks to the committee. I've attended several meetings and think this is a very good group. I'm going to talk about what's become known as the 2019 Elway Healthcare Poll of Oregon voters. If you're following along this with the slide set, which I initially sent in 2 weeks for posting, I have consolidated a few slides for brevity. Number of polls have been conducted on universal health care showing strong public interest in the theory of universal care. But even now, going on 7 years later, the Elway poll remains unique in its direct questions and responsive support for funding universal health care on a state-based, publicly funded basis. The main part of my presentation today will be about the poll and its basic results. Then, as time allows, we will take a break for questions before discussing the poll's implications for messaging, coalition building, as well as some possible thoughts about future polling. Pictures of grandchildren, how does that keep getting in here? I've used this picture in some of my earliest presentations on universal health care. Finding a motive for healthcare reform is not difficult for most of us. I'll just give you another two seconds to absorb that gaze. In 2017, out of frustration that universal care would never be possible without more public understanding and acceptance of the funding, I helped convene a dozen professional volunteers from Mid-Valley Healthcare Advocates in Corvallis and some from HCAO Action in Eugene. We met weekly for almost a year to research the mathematics and legalities of designing publicly funded universal care system in Oregon. We worked with the Legislative Revenue Office under the sponsorship of then State Representative Dan Rayfield, now State Attorney General. Once we had a handle on what we thought the funding possibilities and questions were, the next logical step was to seek Oregon voters' attitudes about funding universal care. I was unable to find a larger organization to sponsor a poll specifically on funding universal care. So I did what seemed obvious at the time and jumped into the world of public opinion research. Problem at that time was that polls for a national single payer system were showing 70% support for the general idea of things like Medicare for all. But when the few polls that actually then asked about a tax to support universal care saw public support dropping into the 30s at the mention of the word tax. One state-based poll from a Western state, which was not released publicly, though I've seen it, just barely broken the 50% barrier. That is still well below the recommended level of 60% before launching a ballot measure. Most polling at that time was commissioned by political groups using partisan wording. I had a lot to learn about public opinion research. First, I learned that there are numbers of types of research available. First question that a good pollster would ask me as a potential client was, who do you want to believe the poll? If you're doing research for your own organizational strategy, no one else will see it. You can gather public input in a variety of ways that are relatively inexpensive. But if you want legislators to believe you, or if you want to publish your results in a peer-reviewed journal, the gold standard in 2019 was, and probably still is, randomized phone survey costing about $35,000. So you can imagine going to your wife and saying, oh, can I have a little extra pocket money? After evaluating a number of very capable independent polling firms, Elway Research of Seattle was selected based on their national reputation, rated one of the 6 best pollsters in the country, and their proposed methodology. Elway proposed a readiness poll, which assumes that voters in general do not yet understand enough about universal care to answer detailed questions, but their general readiness can be tested by stepping through a problem-solving exercise. Is there agreement on a problem? Is there a probable solution? Would you personally support that solution? Poll was conducted with the intention of being vigorously apolitical or non-political. To remain apolitical required carefully scrubbing the poll questions of partisan dog whistles, buzzwords, trying to find neutral language. Although the question writing phase only lasted about 8 weeks of 16-hour-a-day dedication, I refer to March and April of 2019 as the worst 15 months of my life. Finally, we were ready to test the poll on 2 groups of volunteers in the Seattle area. Republican test group said that they thought the survey was about a Republican idea written by Republicans. The Democrats thought it was a survey about a Democratic idea written by Democrats. Once we achieved this intended level of neutrality, we were finally ready to schedule the phone room. Poll was sized to achieve an error margin of plus or minus 5%, 95% level of confidence. Registered Oregon voters were contacted at random via landline or cell phone. Half of the cell phone respondents completed the survey online. Poll was completed over a 4-day period from July 17th to 21st, 2019. Those were 4 nervous days for me because if there'd been any major breaking news involving healthcare during the sample period, we probably would have had to throw the poll results away as invalid. Poll was conducted to match Oregon's actual voter registration, which is 35% Democrat, 25% Republican, and 40% other. The other category includes about 32% of Oregon voters who are non-affiliated, and another 8% who are registered to so-called third party. Because the third party voters are too small a group to track individually, the poll lumped them together with the non-affiliated voters. Poll begins by asking how respondents would rate the healthcare system, current healthcare system, including how we pay for it. Less than half were enthusiastic with the current state of healthcare. This is a very low satisfaction for something that is used every day by most of us. Next, poll respondents were asked to consider 7 cases of potential problems related to cost, complexity, inclusive access, quality, the fact that healthcare is significantly tied to employment, and the need to keep Medicare, Medicaid adequately funded. The respondents were asked to rate each of these as to which were a major problem, a minor problem, or not a problem. The overall winner was cost, with only 4% saying it was not a problem, 81% considering it a major problem. Cost is especially important because it creates or makes worse most of the other potential problems on the list. Here are the 7 areas ranked in order of poll respondent rating: cost, complexity, access, saving Medicare, saving Medicaid, quality of healthcare, healthcare being tied to an employer. At last month's community engagement and communications meeting, I was interested in Colin Stackhouse' presentation on the results of an HCAO questionnaire. That questionnaire shows many similarities with the Yelway results. Issues of financial impact, cost and affordability, and equitable access rank highly in both polls. In polling, it is sometimes useful to allow poll respondents to answer a question in their own words. Question 3 asked, why does healthcare cost so much more in the United States? Answers ranged all over, with some answers being opposite and some similar. Some of the more frequent themes: profit, inefficiency, waste, greed, government involvement, lack of government involvement, insurance companies, doctors' rates, subsidies, lack of subsidies, drug companies, or free riders using the systems. Don't try to make sense out of the shading on this list. It's actually a raw data list from the phone room. Question 4 asked, why do you think the US does not already have universal lifetime healthcare? Some themes that emerged were greed, that some people would lose money, general politics, political division, corporate power, socialism, capitalism, the idea that universal care would be too expensive. There are different ways. Question 5, do you think that universal care is desirable and achievable? Desirable but not achievable, or not a desirable solution. 75% showed initial interest in universal care as desirable, though some of these were skeptical about whether it is achievable. Only 1 in 5 saw universal care as undesirable. Respondents were then given 3 options of how to achieve universal health care: overhauling existing insurance, creating one public payer, eliminating all insurance by changing to public hospitals and clinics. Most common preference was to have one public payer, but it was far from unanimous. The general assumption has been that the idea of public hospitals and clinics is very unpopular to Americans. And yet here in this poll, 1/3 of the respondents were supporting that concept. Question 7 asked if respondents think there is already enough money in the system. Of those with an opinion, the answer was yes by a margin of more than 2 to 1. All of this shows readiness for serious discussions about universal care, but would people actually agree to a tax? And if so, how large of a tax would they agree to? Wording of the question on taxation are important, so I'll read the question from the phone room master. I'm going to describe a proposal that could be placed on the ballot, would establish full lifetime health care, including vision, dental, and hearing for every person in Oregon. Under this plan, you would pay no direct medical costs. That is, no private insurance premiums, copays, or deductibles. Instead, you would pay a new state healthcare tax. A state agency would pay all these medical costs. 60% showed support in the poll for a new healthcare tax of unspecified magnitude. But still, this is far higher than the national polls and other polls had shown. There is an adage in public opinion research that about 20% of the people will vote for something regardless of the details. 20% will be opposed no matter what the details. Trick is to win most of the 60% of voters in between who are waiting for the details before finalizing their opinion. Polls showed universal care winning the middle ground by about 45% to 10%. The next step, after asking them if they would support a tax, is asking them about the magnitude of the tax. I wanted to ask about specific percentages of tax rates, but Stuart Elway of Elway Research believed that the voters are not savvy enough on percentages, so they wouldn't be able to respond to a question like that. The other possibility was to compare the size of the tax to some tax that people would already be familiar with. Stuart and I compromised with two separate questions. First, with me testing whether respondents could guess the income tax percentage, which would be required to replace private insurance premiums, copays, and deductibles. Second question, the major question of the poll, compared the magnitude of the new healthcare tax to the size of the Oregon income tax, which funds most of Oregon state government. The average effective tax rate on Oregonians of the income tax is about 6%, which means that a 6%, 16% total healthcare tax as computed by the Mid-Valley Group would require a new healthcare tax 2 to 3 times greater than the Oregon income tax. And by the way, when you see that 16%, that is assuming that none of the tax is routed through employers. So the fact that in the governance board, for instance, we're seeing lower tax rates is because some of the taxes are being routed through employers. Question 9, what tax rate would you guess would be required to replace premiums, copays, deductibles as a percentage of income? Overall, the average guess from respondents was 11 to 12%. Very consistent with the governance board preliminary calculations after deciding to route some of the tax through employers. I felt somewhat vindicated that Oregon voters really are smart enough to understand percentages. The different average guesses between Democrats and Republicans may actually be correct for their situations. Democrats are more likely to receive health care as a fringe benefit from an employer, so they sometimes don't see the full cost. Republicans, particularly rural Republicans, are more likely to purchase their own insurance and are very aware of the full cost. Now for the big question. Question 10 added 3 provisions to the wording of question 8. They're shown here in blue. Universal care would be funded by a new state healthcare tax, tax 2 to 3 times as much as Oregon's income tax, with employers continuing to pay about the same as they do now, adding that a typical family would pay less than they do now. So, would the large size of the tax frighten people away? The answer was not many. The polling on support dropped just from 66% with no magnitude to 62% said they would definitely or probably vote in favor of a healthcare tax 2 to 3 times the size of Oregon's income tax. This made us happy, but also pretty nervous. Pollsters like it when they all get the same approximate answer to the same questions. There's safety in that. But this poll broke new ground, asking different questions, getting significantly more favorable answers. Compared with the 2 benchmark polls, not only did we get higher response after using the word tax, we'd gotten an unprecedented favorable response even when we explained that the poll would need to, that the tax would need to be relatively large. So why did this poll show stronger voter support for universal health care tax? Was it the systematic way in which the poll focused on the problem-solving approach? I mean, this is a little bit like what can you handhold and walk people toward versus what can you talk people into relative to what people can talk themselves out of. And this is a little bit, I mean, using the problem-solving approach, we're kind of seeing if we can talk them into universal care. Are Oregon voters different from other voters? Did the nonpartisan approach attract wider approval because approval that goes beyond traditional party lines? Difficult to say definitively because no other poll has asked the same questions in the same way. One of the things that stands out is, while the Democratic Party often claims to own the issue of universal health care, only 44% of those in the poll who said they would support a large tax for universal care were Democrats or registered Democrats. This is in part due to Oregon's high percentage of non-affiliated voters, mostly young, and because of the higher than expected Republican and third party support. Support was similar when Oregon's 30 House districts represented by were considered, those represented by Republicans polled almost as high as those districts controlled by Democrats. But this could be considered as kind of an urban rural distinction. One of the most important findings of the poll is that support for universal care in Oregon is extremely age dependent. Virtually all of the net support coming from voters under age 50. What I mean by net support is above age 50s, those in favor and those opposed cancel each other out for no appreciable change in the vote. The 88% support for voters under age 35 is especially worth noting. Here is a graph that shows the percentage by age of satisfaction with the current system. And you can see that from 18 to 34, the green bar is happiness. The red bar up above is rating unsatisfactory or poor. And the 18 to 34, 35 to 50, they're gaining satisfaction. The highest satisfaction is among those age 51 to 64 and those 65 and older.
Just a quick note, Warren, we're about halfway through, so about 22 minutes till public comment.
Okay, thanks. Then here is a similar graph with showing the satisfaction of different kinds of insurance. Those with self-purchased insurance were least happy. Employer full insurance were happier. Those who split the cost with their employer in some ways, less happy. Medicare, quite happy. Oregon Health Plan, not so happy. And other insurance, which we don't get to know what this is, I'd like to know because people are very happy with that. One of the things that we do know is that that would include the people served by Veterans Administration would be in that group. Here again is that same same set of information and showing that the blue bar that goes all the way across is average support for universal care. And then the red bars are showing the individual support of universal care. So the uninsured rated as being unhappy, and yet they're not supporting universal care. Just under self-purchased, we're unhappy, and yet they are not supporting universal care. Those who receive full benefits with no sharing of costs from an employer, of course, we're happy, and they're not supporting universal care. Most of the support is coming from people who split the cost with their employer, or OHP, or the mystery people on the other insurance. A few points about the Elway poll. It's still the most favorable, at least as far as I know, most favorable financial support of universal care of any professional, peer-reviewed, publicly released poll. Poll talks about cost reduction. It talks about improved access for everyone, talks about eliminating complexity. One thing that it does not mention is it does not talk about progressive taxes or wealth taxes. Now, for the sort of bad news, it makes a difference whether you ask for a poll of registered voters or ask for a poll of likely voters. The 2019 poll is potentially sensitive to this question because the highest support is coming from those who are least likely to vote. Registered voters aged 18 to 34 are less than half as likely to actually vote compared with voters over 65. A major challenge for any group hoping to pass a universal care ballot measure in Oregon is how to mobilize younger registered voters to vote. The full report from Elway Research is available at variedstrengths.com. I want to thank fellow business person Ron Lowe of Woodcastle Furniture for helping finance the poll. Thanks to Stuart Elway for his expertise and integrity, and to Dr. Kenneth Rosenberg, whose peer-reviewed article on the poll and the polling methods appeared in the Journal of General Internal Medicine in 2020. One last disclaimer. The poll is about a fictitious ballot measure. The results may or may not apply to any other measure or plan. So thank you. I will stop share. And Michelle, would you like me to go ahead and call on people, or do you want to handle that?
Go for it if you're, yeah.
Okay, Mickey.
Hi, thank you so much for all the work you've done and for bringing us to where we are today. I'm really excited about a future universal health plan. I have a question for you regarding the one of the poll result was 61% total support, but parts of that is yes, if yes, but I need to see more details. There was a report this April 2026 that in 2021, Multnomah County passed a new income tax of approximately 2.5% to fund preschool for all. And a study was published in April 2026 examining that tax found evidence of increased migration and reduced net in migration following the implementation of that tax. And the authors noted that Clark County, Washington County appeared to be a primary beneficiary of those migration patterns, suggesting that some households relocated not only out of Multnomah County, but also out of Oregon entirely. So I wondered if this information was provided then, do you think the answers would have been different? And I wanted to get your opinion since you've been working with this work since, before during the task force days. I wanted to get your opinion as well, knowing that information now, what your thoughts are.
Well, I'm concerned about it. And actually, I'm jumping ahead to something I was going to mention later about if I were to do more polling. One of my big concerns is what just happened to Measure 120, the transportation tax. And is that something to do with people mad at ODOT or I mean, there are things that I'm concerned about. I think that there are ways to handle some of the migration issues. And I've read those same studies, by the way, and probably with about the same thoughts that you've had about them. But certainly my idea is that in order to handle people from out of state, I mean, the idea is we can patch them up and send them home. We don't want people moving here to get free stuff. And so, there has to be some reasonable means to, be sure that and in fact, that was, I think, one of the net or one of the specific principles that we agreed on in the governance board and on the task force is we want to design a plan with no net migration of people in or out. That's easy to say. And I'd like to convince myself that the Multnomah County issues are different, but I think it's a valid question.
Yeah. Are you familiar with the Vermont health plan? I was hearing from a colleague that that's an issue that they were having as well because they have a health plan and that their surrounding neighborhoods were migrating in so that they could also get health plan. Is that what you were alluding to?
Yes, I wasn't alluding to Vermont specifically, but a lot of studies up to now, say that people don't move for healthcare, but that's assuming that they can get healthcare where they are. If we try to do that in an environment where not many people are getting satisfactory healthcare, building the kind of protections it becomes more of a real issue. The things that I have thought of I mean, and I think the Plan Design Committee looked at some things like that you have to be here for some number of months or something before you are qualified to get healthcare other than just on an emergency basis as a visitor. Yeah, thank you for that.
Thank you.
Colin.
Hey, Warren. I'm curious if you could implement some sort of survey in the future. What would your best case scenario be for a new survey that's coordinated by the governance board, or using just surveys as this sort of baseline and how good the LWIN one was and 7 years ago? Like, what would your ideal scenario be for future surveys?
Wow, that's an easy one.
Oh, great.
You know, people survey for different reasons. And for me, the reason I got into it was trying to figure out the answers to what do people really want, and trying to, see if we could get gin rummy out of that. I mean, is there a consistent willingness? It gets a little harder when you begin to talk about, think about messaging, or what the campaign strategies. Those are not the province of any government board, be it the task force or the governance board's job is to just the facts. So the polling gets a little messy. When I was vice chair of the board, I said, we really need some polling. There were some people intervened at a fairly high level that said polling is too political. And kind of what they meant by don't listen to the people, listen to the legislators. Or, that's the process that it goes through. And I'm taking a little bit of what I would have mentioned later in the poll, or in the presentation. I sat down with Stuart Elway earlier this month and tried to make a list of the things that might go in a new poll. There's a lot of difficulties doing that. Of course, me being kind of a numbers person, I'm excited to see how many people want to credit against Part B premiums. Well, that's not going to make a very good poll because people don't really understand what the alternatives are. To me, that is not a good use of a poll. It's good use for randomly created focus groups to where you can, I mean, it's a different kind of public research and more expensive actually. But you can convene a group, give them a certain amount of information, see how they react is one option better than another. In the end, Stuart Elway said that he didn't think that now would be a good time for more polling, just because we're in kind of I'd like to think it's a lull where people don't trust each other, and by that also means they don't trust each other's data. So it's, the question that you really have to think about is, who you're trying to impress. What I proposed to Elway is if I was to do it again, I might not do it myself, but I would try to engage a a coalition of business people, hospital people, advocates, to where everybody feels like they have some input into the polling, because that way they're more likely to believe what comes out of it. But it's, it's very, have to be very careful about the questions. And Stuart Elway laughed at me for believing that that I could put together such a coalition, but that's really what we've got to do in the end anyway. The earlier we can put together a coalition, the better, for the way I think about it. Does that answer your thoughts, Colin? And this will come up more later, so we're not done having that conversation.
Yeah, thanks.
Craig.
Yeah, thank you, Warren, for the presentation. Bear with me, everyone, as I kind of synthesize this, make this question up as I go along. Okay, I have heard that some businesses have opposition to a universal health care plan because they feel it's a strength that if they offer health insurance, they can attract better employees. They want to keep things as they are. I'm pretty sure in the proposed health plan that employers will be taxed something to help support this plan. Here's my question. Will employers save money, pay less for health insurance with just paying a tax than paying some? I know that not all of them supply 100% of the insurance. Some of them, the employees pitch in. But would employers save money by getting behind a plan like this? I'm trying to get more people aboard and trying to think how we can entice the business sector to get aboard. I hope that question made sense. Thank you.
Yeah, and I could have mentioned earlier in the poll another surprising thing besides, another somewhat surprising thing is 61% support from business owners and self-employed in the poll. So there is actually a significant amount of interest there. The employers are all over the map. The corporation I worked for would have favored universal care as we knew it, but we're reluctant to say anything because there's some elements of advocacy that are kind of harsh on business. And I'll say, as a business person, I don't mind people being harsh on business. What I wish the world, I think there's good businesses aren't well enough rewarded. Bad businesses aren't punished enough by regulations and consumers. But I think make a mistake of painting a broad brush. Sometimes I'm asked to give presentations on how do we convince business. Well, business will convince themselves. They know their numbers, and certainly my own belief is the best thing that we can do is the system we have with employers. Some of them pay more, some of them pay less. Mostly that is because of the markets they're in. Markets, if they have high margin, they're providing better wages and better fringe benefits. If there are other markets, typically, agriculture and things just don't have the margins to pay much. So I'm well familiar and concerned about your issues. I think the fact that people say businesses like to use fringe benefits as handcuffs. My own experience is that was not a motivator for the corporation that I worked in. In the end, you're just saying, what's it going to cost? Who's it going to help? Are my employees going to be okay? Those are the kinds of things that they ask about universal care. Michelle.
Thanks so much,
Sorry.
Warren.
I didn't.
Go
I
ahead.
didn't mean to cut Craig off without asking if I had.
Oh, yeah. Well,
Craig,
the
did
other
I?
thing about Craig's question that I was going to mention is, I'm curious, Warren, if you're hearing, I mean, the cost of health insurance going up every year is exponential at this point versus a tax, I would imagine would be more predictable for knowing your numbers year over year. Is that something you're hearing in the business community?
Well, you're exactly right, Michelle. What businesses run on, what businesses can't stand is uncertainty. And if you put them into a place of uncertainty, they're not going to invest, they're not going to hire, they're not going to. So they really need to know, down to, some detail of what they're going to be expected to do before they are in or out. The businesses that I know are kind of generally favorable, but they're going to hold back to the last minute and see how the plan turns out. And if it's unfavorable to business, well, guess what? They'll do what they can to kill it. But as long as it's good for their employees and for them, you'll continue to have their interest.
Yeah. So I do want to check with you, Craig. But
Roy.
just noting that we are right at public
No sé
comment.
qué quieres.
Oh, and I think, oh, there we go. So we're right at the time for public comment. But Craig, I think Warren was asking if your question was answered.
No, yeah, you did. I won't. I had another little thing, but it's not important. Let's go to the public comment. Thank you.
We can come back to this discussion afterwards, but yes, I think we've committed to starting at 5 p.m. So we want to respect anyone's time that is here to share with us, and that's my alarm. Isabel, do we have anyone signed up for live public comment tonight?
Yes, we do. We have one person signed up tonight. So as always, really appreciative of members of the public taking the time to share public comment with the committee. You can sign up to share public comment either in written form or in spoken form like we're about to do now. For written public comment submissions, please send those in via our website 72 hours in advance, and you can sign up on the same page at least 24 hours in advance of the meeting to give spoken public comment. But today we have Lou Sininger sharing public comment with us today, and you should be able to unmute and share your comment now. And I need to edit our timer to be a little bit longer. But it's all set now.
Yeah, I'm not going to take a full 5 minutes, but I really appreciate Warren George's presentation. Of course, I heard most of it years ago. It reminds me that the state of healthcare now is far worse than it was then. So I think that's something to keep in mind. I did want to point out what Warren George pointed out, and that is the 50 to over 65 group that, I'm AFSCME retiree. I feel like I'm a part of them. It's a large voting block. And as we build this program, I think we have to pay attention to that large voting block because they vote. On the other hand, as Warren pointed out, the 18 to 35 group does not vote very often or as much. But however, by 2028, my prediction is that we will have the largest voting turnout ever in Oregon due to the circumstances that we're in. Everybody is going to want to have a say, and everybody's going to want to vote. So keep that in mind. It's just the last and also the other group that I feel that maybe the Community Engagement Committee could keep in mind are firefighters, police officers, and other public employees. They are a voting group and they tend to vote. I think nobody's done a poll on this as much as the older generation. Last comment I would say is, I've heard a lot about the migration. There's differences of opinion. People that don't have much tend to migrate to a better place. People that have vested in their community and their jobs will not move. But the other side of migration that we might want to take a look at is how many medical providers that all they want to do is to provide medical care to the people they serve. That's why they got into those careers. I wonder how many of those would love to migrate to Oregon under a universal plan. So thank you all for good work and good job. I wish there was more of us commenting, but there's not. So thank you again.
Thanks so much, Lou. Thanks for being with us. Appreciate your comments. And then just to round out the public comment section, since it doesn't sound like we have other folks signed up to give live public comment, I did want to make sure that committee members saw in the meeting materials that we do have two written public comments that were submitted. One, I wanted to flag for anyone from HCAO that's on the call, that I think it's someone actually that was trying to get in touch with HCAO and not the governance board or the committee of the governance board. So that was from Angela Hale. So flagging that for your attention. And then the other comment was from Jacqueline from HCAO asking for some updated materials about the updated policy proposals from the board in plain language. So I did just want to mention to committee members and the public that we are working on a plain language summary of the plan as it stands now after some additional votes that the board has taken that will be shorter than the 20-page PDF that we used for the focus groups that I know you all saw. But it will summarize kind of the core elements of the plan and it will be up to date. So that draft will be coming to this committee for review and discussion I'm anticipating at the July meeting. So that is in progress and you all will be part of shaping that. So thank you to everyone who gave live public comment and submitted written public comment, and we will summarize those for the board as well at the July meeting. All right, so I think we're scheduled to take a stretch break. So maybe we can do that, and hopefully that'll also anyone who is someone who likes a little bit of space to process. So you can come back with your questions, and Warren, you can finish out the remainder of the few slides that you might have. So let's take 10 minutes. Does that sound good to folks? Let's come back at 5:17 and we will pick this discussion back up with Warren before finishing out our agenda. Thanks, everyone. Welcome back, everyone. If you are able to turn your camera on or put a note in the chat to let us know that you are back. We would appreciate it. And I'm going to hand things back over to you, Warren, before we finish out our final agenda items.
Okay. Thank you. And let's see here. I'm going to realize that I left out one of the slides that I actually think is most important. Accidentally got skipped over. And that is this one. In 2019, Oregon had 5 congressional House districts. You can see the numbers, and they vary from districts. So 1, 3, and 4 are pretty blue. 5 is kind of purple. 2 is about as red as you can get. So here is a poll. I mean, this is, you know, I have to stop and think about this every once in a while. District 2 voted for Donald Trump in 2016 and 2020, 2-1. And yet here they are polling a majority for universal health care in 2019. And, you know, it's up to different people to stop and consider, you know, why is that? And I think one of the reasons is because rural areas are seeing more, are seeing the problems. I mean, they're kind of the canary, if you will. They're seeing some of the problems before the urban areas are seeing them. Anyway, wanted to be sure that you saw that slide. And let me get on together to talk a little bit about messaging.
Before you start another section, Warren, I do just want to, if you don't mind, check and see if anyone had any final questions that got cut off because of public comment. Is that okay?
Sure.
So just checking. Any other questions? You can put them in the chat. You can unmute, raise your hand from the first section that Warren presented to us. All right.
Okay. So the OA poll was never intended as a messaging poll per se. Was designed to be more of a mechanical poll about how's the best way to design funding, but it accidentally provides some clues about which words and subjects are more likely to resonate with a broader spectrum of voters. Good campaign strategy is about knowing whether you're looking for messages which energize through outrage against a foe or unites through a broader common appeal. Here is a graph which helps identify which of the 7 potential problem areas identified in the poll, how they resonate across the spectrum. And this is broken down by support, probable support, probably oppose, or definitely oppose, compared with those 7. So if you look at the top, cost is an issue that resonates across the spectrum and at a pretty high level. You get into the next areas down. Access actually is very high among supporters and drops off a little bit, you know, carries part of the way across the spectrum, but drops off a little bit for those who more strongly oppose. Complexity is an issue that unites voters across the spectrum Interestingly enough, saving Medicare and saving Medicaid are actually two issues that held majority interest more or less evenly across the spectrum. And I think, given the roller coaster ride that we've had in funding of, I can see why people are interested in this and should be. Interestingly enough, the issues of quality are high for the support. People on the other side of the scale, people are saying, what's any issue of quality? We've got the best healthcare in the world. That's why it costs so much. And so there is some difference in understanding. And the role of the employer is not as high as some of the other issues, but is concern among supporters, less so among opposers. Now, there are some pronounced differences in the language when people answered the open-ended questions, like how much does healthcare cost in the United States? Words favored by what we identified as progressive voters were most often used words like profit, greed, CEO pay. But those are words that are not used by moderate supporters of universal care. The moderate supporters used words like waste, utilization issues, system inefficiencies, incentives to overtreat. These are words that don't maybe inspire much passion, but they appeal to a broader spectrum of voters. For progressives, supporters of universal care, insurance companies are an easy punchline. Moderate supporters of universal care believe that the data that shows insurance companies taking less cut of the pie than any time in the last 60 years, fighting a valiant pushback against out-of-control hospital and provider costs. The moderates are more likely to buy insurance directly and to know and trust their insurance agent. The roles are just flipped for the word government, which moderates often use government as the punchline of their jokes. Fortunately, in looking for words that resonate with both progressive and moderate supporters of universal health care, pharmaceutical companies are fair game. Nobody likes pharmaceutical companies these days. Here's just a fun little thing I threw in several years ago. I suggested the slogan, universal healthcare, efficient and fair. And some people actually put together the graphics for a yard sign on it, which is in many places in the Northwest. And I proposed the slogan, efficient and fair, based on its fairly broad appeal. So now, coalition building, the implication of the Elway poll. Designers and advocates of a universal care system need to give some consideration to the potential coalitions which might combine together to back universal care. So this is a graph that is a little bit hard to, I'll step through it. And so you be sure to understand. As I mentioned earlier, Oregon has a political breakdown of 35% Democrat. Here I'm looking at this column, 35% Democrat, 25% Republican, 40% other voters. The amount of support in the poll for a tax for each one of those categories, the Democrats supported the tax by 80%. Supported the tax. Republicans, 38%. Other voters, 66%. Now you multiply this number by this number, and you know, if you had all the Democrats, you would have 35% of the votes. So, but the fact you only have 80% gives you 27%. So that's less than half of the 60% that you need to get started. Now I'm going to jump down to the other voters that had 66% support, but based on a larger group. So there's 25%. Now, if you add these two numbers together, that's 52%. And there isn't a political strategist that you would recommend that you go to the ballot if your best hope is 52%, even before the campaign starts. So that really, I think the big strategy requires that you get about 40% support from Republicans. You don't need majority support. You can survive with 40% from Republicans. And the poll says that 40% support from Republicans is not out of the question. So now, common motive is going to win the coalitions. And according to the poll, political party motive by itself is unlikely to win universal care. But there are other motives which could drive support. But some of the expected coalition drivers did not materialize in the poll. If the average support was 62%, uninsured was 61%. And a lot of people don't understand the uninsured. Uninsured in Oregon was changing as we speak. They're largely uninsured by choice. They are, the biggest block of them are healthy people who are, because the cost is so high relative to the chance of being sick or hurt, they're avoiding the insurance. Or many of them would qualify for Oregon Health Plan, but since they're healthy, they have never signed up. That actually, we could actually cover the uninsured for almost zero more dollars, because it's actually more of an enforcement problem than a subsidy problem to get people to sign up. And if they would sign up, if they're qualified for OHP, and if they would sign up, that would mean more dollars from the federals. So people who buy their own insurance were expected to be kind of a hotspot of support, but they came in at 51%. People with recent major medical or major health issue in their household were more likely to oppose rather than support, compared with the general population. And you know, you can stop and guess why that would be. It could be that if they've lived through some major issue within their household and had insurance, they know their insurance agent. They are actually afraid of losing that system they've had. Lower income people, you would think, would be strong supporters, but at 63%, that's a little bit stronger. And yeah, at 63%, that's a little bit stronger, but not as high as I might have guessed. Union workers is very hard to tell. I did not ask for a specific breakdown by union households and not union households. So actually, using other means, like the difference between, public employees have a higher union rate than private employees, and yet public employees were down actually almost 10% lower support for the proposed tax. And just anecdotally, the motives of union workers are sometimes great. I've heard some great speeches from union people saying that we've made this an issue for too long. It's helped unions, but it's been bad for the public, and that we need to open up for public healthcare and stop being so stuck on making sure we get better and better benefits than others. But want to go back a little bit. You just and for analytical purposes, I'm going back to this slide on support by age. Analytical purposes, it's easy to divide voters into two groups, under 50 and over 50, and then try to figure out what their different motives are and why there is this big difference between them. So if we just look at their support from on universal care tax, the actual spread between older voters and younger voters is close to 30% differential in their average support. So, and that matches fairly well with their dissatisfaction. But what are they unhappy about? If you look at those seven items that we prioritized earlier, and are looking for something that explains the big difference, not really seeing it here. So, there's hardly any difference in cost, complexity, access, quality. There is actually a hotter button for younger workers, the fact that healthcare comes through their employer. And I suppose not unexpectedly, young people are less interested in the urgency of saving Medicare and Medicaid because they may or may not perceive that they're going to get it. But then going back to, maybe that the young voters still sees the same problems as older voters, but different taboos, let's say, on the solution or constraints on the solution. Going back to the preferred way to achieve universal care, I remarked earlier that it seems surprising to have 1/3 of voters choosing public hospitals and clinics. Well, now if we look at that by age, preference is highly age dependent. Younger voters said that they would even prefer publicly operated hospitals and clinics over a single payer system. So that over a single payer system that would keep healthcare delivery private. And this is one of the things that made me glad that I went with a full spectrum of registered voters. If I only took the poll of likely voters, I might have missed this kind of wave of new idea that is, and as Lou mentioned, maybe it will dissipate, or maybe it will turn the tide in the way that we look at things. So here is the last on the right. The difference in support for public care may give us a clue to young voters and why they are why they are supporting so much higher. What's the missing thing? It's not experiential, but it's something in their belief system or attitude. Of course, couldn't give any presentation without mentioning that the only fair tax is one paid by people you don't know personally, probably wouldn't like anyway. But that is really challenging because one of the techniques that pollsters use is to start, in this case, with the do you think that universal care is desirable? Then keep asking them more questions with more details and see who leaves. So progressives started with the highest support, but it dropped off as we started talking about taxes. Democrats and in general, and Republicans the same way. But here's something that I've never seen happen in a poll. The more we talked about the taxes, the non-affiliated voters, by which I mean young people, are getting more and more excited about paying taxes. This is very interesting to me. So we talked a little bit before about future polling opportunities, but I just did want to mention in polling, it's easy to ask questions with one eye open and the other eye shut. Do you want a red Lamborghini? Most certainly I do. Do I want to make the payments, not to mention the maintenance, auto insurance? Maybe I don't actually want a red Lamborghini. So maybe the question wasn't really valid. Likewise, it's easy to ask red Lamborghini questions about healthcare. Would I be willing to pay a sales tax? Well, it's not enough information. Single-sided questions are incomplete. Real world decisions are choices between fully and equally plausible alternatives. If they aren't based on plausible alternatives, then they have no practical meaning. So I had a little fun posing what would be a valid question about polling on funding of healthcare. Which would you rather have? $800 a month average based on a 10% sales tax, $800 a month based on a 12% income tax, $800 a month from income adjusted premiums, or $1,000 a month and growing every month as long as our healthcare cost keeps rising. This is imperfect question, but it kind of demonstrates the idea of how do you create questions that are full loop, that include everything. So the discussion that I had with Stuart Elway earlier this month, he noted that his concern was trust, and in the environment we're in, we're just lacking a lot of that trust. So then the real question is, without the trust, how do we get the trust back? One of the possibilities is that we just need more awareness. People are not aware of each other. One of the things that I think would be fun as heck is, okay, so let's put a tax on money. How about if we also put a tax on time that says everyone in the state puts in 2 weeks in a nursing facility washing bedpans? Phil Knight next to me. The idea that we're all talking to each other and contributing in areas where one part of the problem is we don't have enough labor to do some of the less desirable work. That we should believe in other people's ability to understand the issues. And I've been rewarded by believing in people and their ability. And of course, you should also believe in your own ability to look at the issues and not just say who's right, but what's right. And lastly, don't set the new rules to fit your own past or anyone else's past. design new rules to fit the future. One of the things, we used to run a campaign called the Million and One Voter. And in order, in many elections, about 2,000 people or 2 million people in Oregon vote. So who is the million and one voter? And it's conceivable. It's someone who voted for Donald Trump. It's conceivable that it's someone who doesn't fit the stereotypes. Above all else, this tells you how long I've been doing this. Above all else, the future of healthcare will be decided by the young. That's one of the things that we're learning. What will they do and why? Will they shift to more like their parents and grandparents as they age and utilize the current healthcare system more? Or will they set a new and exciting course on their own? These boys graduated from high school early this month, and they're off to college. So I will stop share here and really appreciate everybody's patience. We covered a few more areas that I hope were interesting.
Thanks so much, Warren. That was a really rich discussion of not just the poll, but what went into the poll and then what we can learn from the poll and how it relates to the work that we're all doing. So really appreciate all the thought that went into that presentation. And yeah, curious if folks have reflections, questions. I think we could spend up to another 15 minutes on this. Go ahead, Craig.
I'm sorry, my camera is not working. Just a quick question. I know this is a huge question, but I just Googled while Warren was talking, and I just want to say this quickly. It says here around 73 to 78 countries worldwide have implemented some form of universal health care. And anyway, why am I mentioning this? This is a big question, but maybe Warren sounds like an expert. Other countries, did they go to their citizenry, discuss this, and have a national vote? Or did the majority of countries simply say we need healthcare, and the federal government institutionalized it or passed it and said we're going to tax you and it's done? I'm trying to figure out why after 250 years it's such a struggle and we're attempting to reinvent the wheel when all these other countries are moving along. And I'm trying to take advantage of their expertise and their history of implementing a plan. And anyway, I hope my question makes sense.
Yeah.
Thank you, Warren.
Yeah, the question certainly makes sense, Craig. And part of the answer is many of the other world's systems were done. I mean, nearly all of them were done many decades ago, and they were done at a time of national crisis. Some of them after World War II, with a rebuilding kind of society, and so in different countries have different government structures. Taiwan, one of the very last countries to implement it, now at 30 years old, had a more or less a dictator who could make it happen. So those are two things. Our difficulty right now is, once that we have gotten to pay, 3 times as much as England, what we're learning is we can't pay as much as we're paying. Consider, in England, if they have a 20% VAT that provides healthcare at 1/3 of the cost that we pay. If we ask them to cover our cost of healthcare, are they going to raise that to a 40% VAT? No, we're in a real pickle here because of all the stupid stuff trying to think of a word, stupid stuff that we have done over the years. And it's really hard to roll some of those prices or some of those issues back. And I don't necessarily mean prices. I mean, looking at efficiency and we've got an opportunity, and we might be coming up on a point of near level of crisis where we might be able to do something that makes sense. But it would have been so much easier if we had passed Measure 23 in 2002 in Oregon at like 1/5 the cost. It would have been so much easier. As it is, it's going to be tough. I hope that gives you some answer, Craig.
Yes, thank you, Warren.
Mike Leahy.
Hi, Warren. I've just come back from a wedding in Alabama, and I happened to have some conversations there with some of the key administrators from the University of Alabama in Montgomery, and learned a couple things. One, they were asking about how would they fund this, since they're in the same kind of crisis we are. It's a very different state. It's a predominantly conservative, religious, Republican state, but they have the same healthcare needs, of course, that we do. I also noticed they have they have a 10% tax for a hotel, for a little bit less for groceries, but essentially a tax that we all poo-poo, and we say it's, we don't want to do a sales tax because it's regressive. So I'd appreciate if you could comment on, as you've looked at the different tax alternatives, what are some other things that perhaps we should be considering that will get people that are moderate or have voted for Donald Trump, etc., get them to see that not only we're in crisis, but like our folks, me here at the beach, or from folks in Eastern Oregon, they want independence, but they realize they're not getting a fair shake with healthcare.
Sure. Thanks, Mike. First, I would say that I don't think lodging taxes do much, and partly because lodging taxes put on by cities and local governments are pretty high. So the governance board, the Finance and Revenue Committee, is talking about a very small tax that really wouldn't raise. I think the goal is to have something like a lodging tax or a sales tax that out-of-staters would pay, that would help cover the costs of care to people from out of state. I'm unconvinced. Well, maybe I travel enough to resent the local lodging taxes, but I don't feel good about that one. The one that I feel better about, which was actually in one of the last slides, is if the answer is the less change to the current system that you apply, the better, because people worry a lot about change. So if we keep paying premiums, but we make the premiums income adjusted, we can still be talking about premiums just like we've always paid, except they'll be a little bit different and they'll be a little lower. So that would be my suggestion of something new that could be looked at, Mike, is you avoid the word tax. People are used to paying premiums, and they can do doing that. And if you make the premiums in some way income adjusted to achieve some of the balancing that at a level that we might be capable of. I think that would give us a better chance than going to ballot with a 10% tax. So yeah, I hope that gives you some kind of an answer, Mike. Colin.
Yeah, thanks. Two maybe larger takeaways that I'm able to, sort through out of like the many sort of data points that were collected in the survey is that like across the state, there's general support, so I'm kind of feeling buoyed that like, oh, all hope is not lost in 2019 with, across all parties that there's generally overall like over like 60-ish% of support for this idea back in 2019. So that feels cool. And the other takeaway that I'm getting that like I think applies to community engagement is the language that matters. The people that are really supportive of universal healthcare already are happy to talk about progressive ideas like CEOs making too much money, and then other folks respond better to different language. So I think the language thing is something that like we as a group can take forward. Am I wrong, Warren, about those 2 points?
No, you're doing well.
Okay, great.
I would, if you don't mind, I'd like to add a point.
Sure.
That I think what the poll showed is that voters have a lot of readiness for universal care. Legislators, they are playing the party lines and trying to marshal their forces and create difference because they win that way. So I think this is an example of the people being more willing to look at new things, and legislators trying to protect some kind of power status quo.
Okay. Cool. Okay, so I feel good about sort of latching onto some of those key points, and then I guess I'm kind of restating the question that I asked about an hour ago, but it's different now. And it's also like nothing's determined by us on this in this committee, but in there could be some argument for like we should do a survey after the plan is delivered. I guess I'm curious about like what we all think about what action, if any, we can take in similar things to a survey or into more outreach. To me, like, okay, a survey is interesting to gauge perspective, but as far as like input towards the plan, like that's happening in this moment, until September, and then there's more opportunities for development of the plan after the governance board delivers it, and there's some work in the legislature, but that's not really, I don't think, served by a survey. Maybe it is. And then so the coalition building collaborating with businesses, I'm curious if there's a way to approach it that like both does a survey to gather how people are feeling and then also giving them the opportunity to engage with it, which, like I said, is sort of now and the clock is ticking. So I guess to wrap up the question is like, do you see a path forward for something that we should do in the next year regarding this kind of survey or something similar? Or should we take the information that we've gathered and move on to sort of a different approach?
Yeah, I think for me right now, my vision doesn't go out beyond September or December, because I think there's still things that could change relative to the governance board recommendation, and you might spend $35,000 on a question that was completely irrelevant. So I think from my perspective, it's a little bit of a wait and see until we get something that we can kind of get our jaws on, if you will, and see if we can chew it. And I don't think we're that far along. The other thing is that we've still got a long ways to go with public understanding, because this thing could go in different ways. And that could change it at any minute. Like I say, I looked at it earlier this month with the idea of doing a mini follow-up with about half the number of questions as a Yellowway poll, hitting on some of the same questions and providing some new ones, and kind of based on advice from Stuart Elway, have waiting on the shelf. I thought it would be fun to have some new answers for this presentation, and it could have been possible to rush those through, but the difficulty is you have to really understand what questions you really need to ask, and polling is, I can tell you, expensive enough that you don't just want to shotgun it with anything that you could think of. You really need to be pretty strategic about how it relates to design. One of the things that I think has been a big mistake of the governance board and was of the task force is you've got this, and Lou mentioned this earlier, you've got this big block in the people above 50 who are not aren't very interested. Well, you really need to, I mean, it's a mistake to throw them in the same basket as everyone else. You know, I think their needs are a little bit different. The idea of they pay the same tax for as everyone else, when in fact they may be getting fewer additional benefits because they're already getting a lot of the benefits are covered. I really think that you need to break those, to break that down and study those people a little bit different. And if you don't, it's going to be tough getting past them. So I think that's a mistake that you know, I've tried to talk up before, but really hasn't gone anywhere because it adds a whole nother layer of complexity to the governance board's work, and you know, I'd rather get some things to the finish line, and knowing that we've got have some more work to do. So I'll move on to Mickey.
Hi, Warren. Thank you. I'm curious. So I've been working in local government for 15 years, local government, city, counties, now an intergovernmental council. I have really amazing health plan coverage that they pay for. And then I'm wondering if it's the same thing for state government employees and federal government employees who work in the state of Oregon. And so for me, for example, I only pay $280 per month, and the rest is paid for by my employer. So then I'm wondering, why would I want to pay 10% taxes if that's going to be a lot more than what I'm already paying now? And then I think about also the people who are, you know, the ALICE acronym, the Asset Limited Income Constrained Employed, who they're above the poverty line, the federal poverty line. So they make more, but so they might not qualify for any waivers if there were to be any waivers in the future. And then some households who cannot afford right now, there's issues with housing, affordable housing, homelessness, and some are at the brink of homelessness because they can't even afford, they're living paycheck to paycheck, can't afford an extra $500 per month to repair a car breakdown or something. So I'm wondering, for somebody like me, government employees, or somebody who might be an ALICE person who are living paycheck to paycheck, and all the things that I said, your thoughts on why they would actually say yes, charge me 10% income tax when they're already paying much less than that.
Oh, okay. Thank you, Mickey. You've hit on something that has been a stumbling block ever since I got involved, and that is people's perceptions about their fringe benefits. So the way that an economist would look at your situation is that you are effectively now paying probably something like 18% for your health care. And part of that comes out of your check. Most of it is in your fringe benefits, which are part of your compensation package. So something that's important to me is that for whether you have an employer or not, the total amount you pay, either that you pay or that your employer pays on your behalf, is the same as someone who pays their own full tax. So we've got a lot of work to go, because ever since World War II, we've been pretending that the employers buys health care, and they're actually just a middleman in the process, the same as government. But that's public perception is different from that. And until we can get on the same page, we're going to be struggling with things like in the finance and revenue meetings. What's a just amount of credit that you get off of your taxes, depending on how much your employer is already paying on your behalf? Those are tough questions, because I'm not sure that people really, we haven't come up with a good way to frame the problem so that that everyone understands. You reminded me on the governance board, something that I got a little hot under the collar on, and I don't often get hot under the collar, is that the plan that the task force came up with would take all taxpayer money that goes to pay employee benefits, healthcare, and that would just go straight into the single payer fund. To me, I say that's just plain wrong. Those benefits belong to the employee, and you can't just confiscate them, even if it's for the public good. And you mentioned people on the edge. The elephant in the room is that been tracking the last 30 years since, 1986. Looking the bottom 40% of the population in 1986 had about 9% of the income in the United States. Now the bottom 40% is living on about 5.75% of the total income. And that is a real challenge. And it's the reasons are not simple. They have to do with automation, offshoring, and it's related to the cost of healthcare, because people would rather offshore than pay the high healthcare costs. But the answer is, unless we can figure out a way to have a what I call a participative economy, we're going to be in real trouble. And Michelle, I'll let you direct time here. I'm willing to stay a few minutes if other people want, but it's your show.
Thanks, Warren. I did want to just check in with the committee briefly. I have a proposal. So my impulse as facilitator is to go where the energy is, and clearly this discussion, there's still juice in it. So I propose that we move our communications and engagement update to our July agenda. That was discussing briefly the focus group addendum from the Deaf and Hard of Hearing focus group, and reviewing a draft of the community engagement portion of the report for the board's report. We will still have time to discuss and make edits in July. So I propose we move those and hold committee member updates for tonight so that we can get to the rest of the hands. And then I am committed to respecting everyone's time and ending at our publicly posted time of 6:30. So does any committee member want to disagree with that? And I really want to look at some of these other agenda items tonight, or is it okay if we hold it over till our July agenda? Folks can put a message in the chat, or thumbs up or thumbs down. Okay, I'm not seeing any objections, so we will continue this discussion until 6:25, at which point we will do our meeting reflection and future topics, and then we will close out. And I also just wanted to say, I put it in the chat. Thank you, Mike and Mary Lou, for joining us. Committee members, members of the public, these are fellow board members that are joining us tonight. So I know that people who are attendees from the general public can't come on camera and ask questions. The reason we're making an exception for non-committee members is because these are our fellow board members. So I just wanted to make sure that was clear. So I'll turn it back over to you, Warren, to finish up with the hands that are up.
Okay, Mickey.
Oh, I just wanted to circle back and just say, for perspective, my employer pays $33,000 per year, and I pay out of pocket $3,360 per year, or $280 per month, and my prescriptions are like $2 per prescription, and I copay is $5. I can't recall my deductible right now and my total max per year, but it's just, to me, from like my small perspective, it just seems like, okay, I'm only paying $280, and then if I vote for this and there's going to be income tax, I'm going to now pay 10% of my income. So that's the perception. So I'm sure there's a solution that you all would have probably brainstormed and talked about.
Thanks, Mickey. If I got that, part of the issue there, and it's a big issue, is that if the employer pays it, you get it tax-free. If you pay it, it's out of your taxable income. So, people talk about, that the employers get this tax benefit by paying for the healthcare. Actually, no, they don't, or not one that they would get anyway. As an employer, you really don't care how much of it is in wages and how much of it's in fringe benefits. It all goes to the same part on your bottom line, which is the cost of labor. What you've said some big numbers there. There are other proposals, including Taiwan, where, because public employees often get better benefits, that they would pay bigger taxes. I'd rather get everybody on the same footing myself, but there are people who have proposed that we do that. Gerald Friedman, one of the major healthcare economists, proposed tax for Oregon, where public employees would pay 5% more than private employees. I don't like that, but one of the things that you're trying to do is you're trying to capture the money that's already exists in the system. Well, the money that's in the system is probably distributed a little bit unfairly, but changing it may be just too much problem. I don't think I hit the ball very well on your question, Mickey, but I think I've got some the taxes are a huge thing. One of the things that I helped write some parts, or got input on the state-based Universal Health Care Act, which is in Congress. And one of the things that's important to have in that bill is to have a state, no matter who pays, I mean, whether it's paid as a tax or whether it's paid by the employer, that we don't lose the federal tax breaks that we have, so that there would not be, no state would be punished by changing their tax structure. Or, I happen to be one who says, let's get the employer out of it entirely. But that can't be done with a lot of tax consequences, and that may or may not be popular with the public either way. So anyway, I hope that helped. Mary Lou.
Thank you.
Thanks, Mickey, and others. My daughter is a Portland public school teacher, and so she has a good union that has done a good job of negotiating healthcare benefits for all the teachers and other people who work in Portland District. And then the managers also benefit. My father was a vice president of the phone company, and he said to me early on, Mary, I support unions because if we didn't have unions pushing salaries up, you can bet they wouldn't be giving managers increases. So really everybody benefits from the unions, although management loves to say they don't. But the bottom line is hers actually was $2,400 a month that the school district was paying on her behalf, which works out to be like 29,000. So you've even got a better plan, Mickey, at 33. But what happened with her is uncertainty, and she ended up having to go half-time. And so now she is having to pay half of that, which is $1,200 a month on a half-time salary. The other thing that happened when the union struck was the real bargaining chip that the school district had was saying, hey, if you don't settle by the first of next month, we're going to stop the health insurance payment. So I think some of it is really looking at the benefit, and I was a county employee, so I had the same kind of thing you're talking about. And I was lucky at the time I was there, things weren't cutting back. But I just think that there's a lot of, Portland people that are being laid off, city of Portland people, a lot of folks that have really had that and not had to worry about it. And all of a sudden it's gone, or they're having to pay a whole bunch for it. So I think certainty, which was talked about from the business point of view, I think also can be stressed from individuals' point of view, that what you've got and how it's going, you're not real certain what's going to happen around the corner. So that would be just one of my pieces. And anyway, it was quite a shock for her. She had never paid attention to how much the district was paying for her insurance until all of a sudden she was having to pay $1,200 a month on a half-time salary. So that was just a thought I had.
Thank you, Mary Lou. You said something that resonated with me, which is half-time workers. I've been doing in conjunction with Charlie Swanson, looking at which industries and which groups of people get more fringe benefits than others. And I'm just aghast at what I will consider shameful, the disadvantage that people who work 2 half-time jobs and get no benefits, to me is just shameful. And we shouldn't be allowing it. And hopefully our plan will capture the equity of that, and instead of the situation that we have. Colin?
Yeah, to continue or just a perspective about like equity, like how we double tax our contractors. I'm self-employed as a contractor, and just by the way that shakes out, I've been self-employed for 5 years, and so I'm double taxed often on many things. And there's been some framework for this plan that describes that similar, issue potentially going forward. Yeah, I wanted to respond to 2 things that Mickey brought up. One was I'm sorry, I forget the acronym that you said, but poor people who are already like really stressed. But based on the last from April, the summary from the governance board, I think that it's around 200% of the federal poverty level is when people would start potentially paying into this new system, right? So now I think for a single person, that's around 32K, right? So it's after that point they'd start having to pay more. And then another response is something that it's like a personal opinion that I need to figure out how to practice saying. Oh, thank you. Practice saying for the next 2 years, right? For people who are employed by their local governments and also government officials, which is that I don't think it's fair, Mickey, that you are serving your community and you have better coverage than they do. Like you are able to be fortunate enough to have those, to have the care and like the premiums and the care that you're describing. And And personally, I don't think that people should be allowed to serve communities without having everyone in their community have the same access to that care, right? And so that's sort of a framework that I'm going to say often, I think, but practicing it here. So thanks.
Thanks, Colin. And that's a really interesting one to me, and one that I'm almost kind of afraid to mention. But in trying to find different kinds of equity, and we never will perfectly, but there was a time when nurses and school teachers made about the same. Now we are nurses now make, I'm not sure the number, somewhere between 30 and 80% more than teachers, because teachers' wages are constrained by public income. So now we might be exposing more people to that. And how do we do that in a just way? I'm not really in favor of having a meeting and saying, this is worth so many points, or this is worth so many points. But I do think that as the world goes in the direction that we're headed, that we can't just be pushing against a wall and not caring what's on the other side. We have to kind of think up new definitions of equity, and spreading out ownership is part of that. I think employees the company I worked for sold the majority of its stock to its employees. And it turns out that we made money as owners and as employees. And it's actually, I think, the more that you can fit in your head at once, I'm not just an employee, I'm an owner, so that I'm having to look at both sides. I'm looking at, look at a problem through both eyes, I think was kind of instructive to me. And this was a strong union plant, which created even more kind of dual personality. The union's very strong, and as a manager, unions would be very demanding of what they wanted, but they'd also kind of, with a wink that says, if we can afford it, this is what we'd like. But that's, the conversation with Mickey and your response to it, I think opens it up that we do really kind of need to talk about some things that don't really have the language for currently. And my heart is with the people trying to make it on really low wages. And I'm willing to try to move a little left or right to try to see how we can accommodate those. So and it's you have to put your muck shoes on, because you even start talking about things like that, and you need to go clean your shoes, because it's not going to be easy conversation. And given the history of the United States, where everybody just pushes for whatever they can get, well, I think some of that's got to be over. If we care about each other and want to do the thing that is most just, if we can. I served on the Principles and Values Committee of the governance board with Michelle, and we had a little bit of fun with that, but it's going to get into new territory, either inadvertently, not necessarily because we intend it to, but because of the decisions that we make will have an effect on different populations in different ways. As I mentioned, I'm particularly concerned about the bottom 40%, and how we provide ways to for them to participate in an economy, or we can all go work in the nursing homes for free. Okay, well, I think with that, I think Colin, you and I have baffled everyone. So I don't see any more hands. I don't see any more hands up. Oh, there's Craig.
I'll just throw something in here. I used to work for a courier service. I was the third employee there. And when I left, there were probably 40, 50 people. What's the point? Sometimes we had health insurance, other times we didn't. When the Affordable Care Act was passed, I was the only employee that was for it. Here I'm working with people struggling to get by. We work very hard, very long hours. No vision, no medical, no dental, no pension. And yet 95% of the employees were against the Affordable Care Act. What's my point? I think this is going to be a tough nut to crack. There's a lot of people who do vote against their own self-best interest. It's shocking to me. I agree with you. Obviously, everyone here at on this committee. I had a conversation with a friend I hadn't seen in years, and he was in town. He asked me to see him. He used to be apolitical. Now he's become very political and very conservative. And what's my point? Somehow he got on. He brought up, I didn't bring up politics. He brought up healthcare and how he's against national healthcare. And my one comment to him was, how come you never, he was very lucky. He worked for Boeing and retired there, and has a great retirement and so on. And I said, how come you never ever talk about people who are working a job at minimum wage with no benefits? Where is your compassion? He's also become very religious, and I could not thread the needle. I couldn't understand his logic. I'm not just giving a speech here. I'm simply commenting and reflecting back on what's going on in our society and how hard this is going to be. We're at such a loggerhead. But the good news is, I say this, we're still here. We don't want to give up on this. And hopefully I'll see it before I die. On the other hand, I don't think I will, because the country's 250 years old now, and we still don't have this. But we've got to keep trying. I'll try every day till I die. But it was more of a comment, I guess, than a question. But anyway, thank you for hearing me.
Thanks, Craig. I see that we're running out of time here. Just kind of summarize on the Elway poll. Not everybody's crazy enough to do what I did back then with a little help. But I think the poll really showed that it's a credible idea. Universal care is a credible idea with that's capable of being a mainstream idea, if we can figure out how to do that. I think in this round it's a little bit tough to suddenly invite business in at this late, because the idea of collaboration starts kind of at the beginning of a process. But I think there can be new processes that can involve collaboration. And the hospital association is certainly, those people are always open to talk about things, but we really do have a long way to go to really understand each other and some of the things that we believed all our lives. Some of those we might have to adjust a little bit in order to come up with a universal plan that everybody can get on board with. But I think there is hope. The kind of comments and interest that I'm hearing today is really shows a lot of sincerity and willingness to look at new ideas. So really appreciate Michelle being appreciate being asked to speak. I hope I've um, been clear enough, and I apologize to interpreter who I can't imagine trying to keep up with me. But thank you very much.
You've given us a lot to think about. And on that note, I'd love to, in our last 3 minutes, just open the floor for any reflections on this meeting, any future topics. Again, we'll have those agenda items moved to July. Anything else on folks' minds? This has been a rich discussion. Thank you all. Not hearing much. If you're someone who takes a minute to process, feel free to drop it in the chat if you have a request for a future agenda item or a reflection on this meeting. Thank you again, Warren, for being so generous with your time and your knowledge and your passion for this subject. I think my takeaway is that the only way that we get to broad appeal is if we set aside our egos and identities and affiliations and really try to find that neutral language to describe this, that we cannot describe this from within our bubbles and be successful. So that was very clear, and I really appreciate that. I think that that's really valuable insight. Anyone else? Mary Lou.
Just thank you for letting Mike and I say a few things. That it was, didn't want to interrupt the group and listen, whatever. And just thank you. It was nice.
Thanks for joining, Mary Lou and Mike. All right. Well, I guess the final thing that I would leave us with is, I think the question that Craig raised for all of us around how do we see each other's humanity? How do we understand each other in this moment where the stakes are higher than they've ever been? Inequality is on all of our hearts. We've each got our own story that we're living, and it's hard to sometimes understand the actions of others. I would just offer that The Righteous Mind, Why Good People Are Divided on Politics and Religion by Jonathan Haidt is one of the best books I've ever read on the topic. It really comforted me and gave me a lot of perspective to see beyond my limited perspective and see the full humanity of people that I disagreed with. And I think that that's really important in this work and just in the world right now as humans. So I hope that's a helpful resource for somebody. But I look forward to picking this discussion back up in a month's time. Thank you all for your volunteer work. I appreciate each of you and your contributions. Have a great evening, and we'll talk soon.